Greetings, Doctor. We are Group 18, and our assignment topic is Relate Human Musculoskeletal System Knowledge towards the application of biomedical engineering practices in the society, and we are focusing on analyzing the leg brace support. So here are our group members. We have myself, Lufia, Changjie, and Fatih Natasha, and the number below here are our metric number. Next, I will talk about the introduction of leg brace supports. So what is leg brace supports? Not everybody need to use it. Just some people with leg injuries or surgeries need to use it. For example, the football player get injured in the match, and after they do the surgery such like ACL surgery, they will use the leg brace supports to prevent them from secondary injury. So its function is over here. That is, the first, it can offer stabilization, and it can also reduce the painful for the patients. And third, these also supports healing by keeping the leg properly aligned, so the body can recover without extra strain. So in short, the leg brace supports aren't just medical devices. They are tools that make recovery faster, movement easier, and life better for many people.
Next, we are going to look at examples of diseases or injuries that requires the usage of leg braces. First, osteoarthritis or OA most commonly affects the knee, which is a synovial hinge joint. This condition involves the degeneration of articular cartilage, the smooth layer that covers the bone surfaces within the joint, specifically between the femur, tibia, and patella. As the cartilage wears away, the joint spaces narrows, causing bone-on-bone friction. Over time, osteophytes or bone spurs may form. The joint capsule and synovial membrane, which normally protect and lubricate the joint, can also become inflamed or degrade. A knee brace helps in this situation by redistributing the mechanical load away from the damaged area and improving joint alignment, which can reduce pain and slow down further wear. Now, moving on to ACL injuries, one of the most common sports-related knee injuries. The anterior cruciate ligament, or ACL, is found inside the knee joint, which is also a type of synovial hinge joint. The ACL connects the femur to the tibia and plays a key role in maintaining anterior-posterior stability of the knee. When the ACL is torn, often due to sudden twisting or impact, the joint loses its stability, even though the bones themselves usually remain intact. In many cases, other structures like the meniscus or joint capsule may also be affected. During recovery, the surrounding muscles, especially the quadriceps and hamstrings, often weaken due to reduced usage. A functional knee brace is used to limit excessive joint movement and provide external stability during rehabilitation. Next, let's summarize the common anatomical structures involved in the usage of leg braces. First, the joints. The knee joint and ankle joint are both synovial hinge joints, allowing flexion and extension. These joints are frequent sites of bracing due to their weight-bearing roles and susceptibility to injury or degeneration. In terms of soft tissues, the most affected tissues include the articular cartilage, which provides a smooth, frictionless surface inside the joint, the ACL, which stabilizes the knee during movement, the meniscus, a crescent-shaped cartilage that acts as a shock absorber in the knee, and in the ankle, the anterior talofibular ligament, or ATFL, is the most commonly injured ligament during ankle sprains. The Achilles tendon is also important as it connects the calf muscle to the heel bone and is vital for walking. Next, we will look at the muscles. Quadriceps and hamstrings control the knee extension and flexion and often weaken after injury. Calf muscles, along with tibialis anterior, control movement of the foot and ankle, especially during walking. Finally, we will look at the bones that are commonly involved. The femur, which is the thigh bone and the largest bone in the human body. Tibia and fibula, which supports the lower leg. Patella, the kneecap, which increases leverage of the quadriceps muscle, and the talus, located in the ankle, connecting the leg to the foot. Bracing supports these anatomical structures by reducing mechanical strain, improving alignment, and preventing excessive or harmful movements, ultimately protecting the joint and surrounding soft tissues during both movement and recovery. Understanding these anatomical structures help us to appreciate how leg braces not only support healing but also help maintain functional mobility in daily life and rehabilitation.
My name is Fatin Natasha and I will be explaining the effect of disease or injury at joint. So the first one is knee osteoarthritis. There are two types of them, which is the primary and the secondary. So the difference between the primary and secondary knee osteoarthritis is the reason or the cause of them. So primary knee osteoarthritis are usually due to unknown reason or old age, wear and tear. Meanwhile, secondary is due to known reasons such as like injury that a patient has gone through. So we will be looking at three effects, which are joint pain and stiffness, swelling and inflammation, and lastly, reduced range of motion. Now let's dive into each effects that knee osteoarthritis have towards the patient. So the first is joint pain and stiffness. As we know, the cartilage acts like a cushion in between the bones. And so as the cartilage deteriorates, the bones begins to rub directly against each other, and this creates friction. This friction will lead to pain, which is often activity-related worsening. In other words, as the patient goes on with their days doing activities like walking or running, it would cause them to feel more severe pain. And second, which is related to the first one, swelling and inflammation. So as the protective cartilage wears away, the bones begins to rub together, and this friction irritates the joint lining or the synovium, triggering inflammation. So the synovium reacts by producing more fluid in order to protect the joint, but this actually have a reverse effect, which leads to visible swelling, warmth, and stiffness. And so the swelling will increase intra-articular pressure, which can worsen the pain and further restrict the movement of the patient, which leads to our last point, which is reduced range of motion. So when patients have the swellings on their knees, it would restrict their movements because their knees are not able to fully extend during fences or fully flex during swing phase. And this often affects the sagittal plane, which is the movement of forward and backward. And this would lead the patient to have shorter steps, slower walking speed, and increased energy expenditure as they are not able to use their knee properly in the full functioning way. Second is ACL injury. So most ACL injuries are non-contact, often occurring during sudden deceleration, pivoting, or landing on a hyperextended knee. The injury typically involves a valgus force or inward collapse combined with internal tibial rotation, which would lead to the ligament being overstretched or sometimes completely torn in certain cases. So there would be three effects, which are the joint instability, muscle atrophy, and altered gait and posture. The first effect is joint instability. So as the ACL is a key stabilizer of the knee, especially during rotational movement and sudden directional changes, the tibia or the shin bone can slide forward excessively relative to the femur or the thigh bones. So the instability would alter the joint's kinetic and also kinematic movement, increasing stress on other structures like the meniscus and the cartilage. Secondly is muscle atrophy. So arthrogenic muscle inhibition or AMI is a reflective shutdown of muscles around the joint, especially the quadriceps. This would lead to muscle atrophy in the quads and hamstring due to disuse of and altered neuromuscular control. Long-term weakness can persist even after reconstruction, affecting joint supports and performance. Or in other words, it is when certain parts of the muscle near the joint is not being used, so the body shuts it down, and sometimes it will not be able to be recovered even after reconstruction. And lastly is the altered gait and posture. Example is the quadriceps avoidant gait, where the patient reduces knee flexion during walking to minimize axial tibial translation. There may be reduced stride length, slower walking speed, and increased reliance on the hip and ankle joints. So in other words, it is when a patient is experiencing pain on one knee, so they tend to put their body weight and that causes pressure on another side of their legs. And this, when is being done again and again over time, the adaptations can lead to postural imbalance, asymmetrical loading, and even back or hip discomfort towards the patient.
Greetings, doctor. My name is Peng Jie. Today, I would like to present about the application of leg brace support. What is leg brace support? A leg brace support is a medical device used to support the knee joint. It helps people recover from injuries like torn ligament, including the anterior cruciate ligament (ACL), medial collateral ligament (MCL), PCL, and LCL. Braces are also used after surgery to relieve pain from the knee arteries by offloading pressure from damaged area. These devices are designed using knowledge of how our bones, joints, and muscles work. Biomedical engineers apply this understanding to create braces that improve stability, reduce pain, and support healing. It is a great example of how biology and engineering come together to improve movement and recovery. Leg brace support play a vital role in helping individuals manage leg pain or recover from injuries. First, stabilization. Leg brace support can keep the leg safe by preventing harmful movement that could worsen injuries. Pain relief by elevating pressure that makes walking or standing more comfortable. Healing promotion. Proper alignment ensures recovery without added strain. Confidence boost. Leg brace support enables individuals to move securely and resume daily or sports activity. Applying a leg brace support correctly is essential for comfort and effectiveness. First, make sure the leg is clean and dry. You can wear a thin layer underneath the brace if needed. Next, sit with your knee bent around 45 degrees and align the brace hinge with the natural bend of your knee. Start fastening the straps from the bottom, then move to the top. Make sure it's comfortable but not too tight. Leave just enough room for one finger. Finally, stand out and walk a few steps. Check for any slipping or discomfort and make adjustment. The two-finger test is a good check. Comfortable but not too tight. Let's going through its benefits. First, functional knee braces can improve knee extension during walking and enhance the load response of the ankle and foot, thereby improving overall joint function. Second, compression and support materials. A combination of advanced materials like breathable fabrics and lightweight composites enhance the comfort and wear resistance of braces. These materials' effectiveness control swelling and provide necessary support while maintaining mobility. Third, incorporating smart materials and wearable technology into orthopedic supports enable braces to adjust their properties based on the wearer's activity levels and needs. However, for its limitation, prolonged use of a brace may cause muscle weakness. By providing external support, braces can reduce surrounding muscle activity, potentially leading to muscle atrophy and increased instability. Second, brace may cause discomfort, including skin irritation or chafing, especially when worn for long periods of time. Choosing the right brace made of breathable materials can help solve this issue. Third, some braces restrict natural movement, thereby limiting the range of motion required for certain activities. This limitation may create challenges for those who rely on full mobility for sports or daily tasks.
Next, I will talk about the social impact. So, the leg brace support has a profound social impact, especially for individuals with mobility impairments caused by conditions such as stroke, cerebral palsy, or spinal cord injuries. These devices not only improve physical stability and gait, but also restore a sense of independence and dignity. So for many users, leg brace support reduce reliance on caregivers, enhance participation in daily activities, and even enable return to work or school. So the leg brace support lead to better quality of life and social inclusion. So looking ahead, the leg brace support technology is moving toward being lighter, smarter, and more accessible. With better materials, the future braces will be more comfortable and easier to wear. The basic smart features like sensors that adjust the support based on movement are also becoming more common. Most importantly, as the demand for home-based care grows, leg brace supports have the potential to become essential tools, not only for rehabilitation, but also for helping more people live independently with less need for full-time assistance. So in short, the leg brace support future is about simple, smart solutions that give people more freedom in everyday life.
As a conclusion, understanding the human musculoskeletal system, how bones, muscles, ligaments, and joints work together, forms the foundation for developing effective biomedical solutions like leg braces. By studying the anatomy and biomechanics of the knee joint, biomedical engineers can design braces that not only stabilize and protect, but also assist in rehabilitation, reduce pain, and enhance mobility. The leg brace is a perfect example of how engineering meets anatomy. Through this integration of biology and technology, biomedical engineering transforms theoretical knowledge into practical tools that improve lives, restore movement, and support the healing process. That's all for now. See you.